And it's great to see so many of you here today. We've got a really great panel of colleagues from a range of different organisations who are going to perhaps explore some of the things that Marmot himself was talking about. I found it a really fascinating. Marmot is always interesting to listen to. I presented a very dismal picture of life expectancy, of regional variations in the effects of austerity and the effects of the pandemic, and we want to explore some of those in more detail. We've not got a huge amount of time to explore those, and so there probably won't be time for questions from the audience, but that's not to say you shouldn't engage with the panel and with each other. So there will be an opportunity. The panel and the panelists will be around for the rest of the day, so if you have specific questions, do talk to them about it. And then each of you has also been given postcards when you checked in. Do complete those, do write your comments on those, and provide thoughts, questions, ideas that arise from what we speak about today and what you've experienced today. Just to say what Eastern Arc is, it is a consortium of the three universities of UEA, Essex and Kent, and we've been around for about 10 years. The idea behind it is to encourage collaboration and to make positive mutual links across the three universities, but also to advocate on behalf of the universities, but more importantly on behalf of the region. And I see the three universities as part of a much wider network of organisations, of institutions, of community groups, of individual stakeholders, of local authorities, trusts, and so forth, almost a lightning rod for all of those coming together. I won't go into great detail with that because we've got a limited amount of time, and if I may, I'll invite the panellists to come and take their place. Thank you very much. Thank you very much for joining us. Firstly, introductions. I'll get each of the panellists to introduce themselves and say a bit about their background. Kevin, can I come to you first?
Okay, of course you can, Phil. Hello, my name's Kevin Daniels. I'm a professor in Norwich Business School. My background is in occupational health and safety, but I currently lead for something called Partnerships for East Coast Communities, which is a consortium of 3 universities and 3 county councils, and hopefully we're going to expand that consortium over time to look at taking action in coastal communities around heritage, cultural heritage, the physical environment, and work with an aim of reducing coastal health inequalities.
Great, thanks very much, Kevin. Stuart, can I come to you next?
Hi everyone, my name is Stuart Lyons. I'm the Interim Director of Public Health in Norfolk, the Norfolk County Council. I've been here for about 3 months or so, learning how Norfolk works. Fantastic place to be, loads of aspiration and ambition. Previously I worked in London and around London. I've worked in public health for about 20 or so years, and before that I actually started off in environmental health, if anyone knows environmental health. I particularly worked in areas around housing and poor housing conditions.
Thanks very much, Stuart. Louise.
Hi, I'm Louise Wilsher. I'm Strategic Head of Innovation and Growth at Community 360. We're a charity based in Essex, particularly Colchester and Braintree, but operating a number of programmes of work across the county. On the one hand, we support improving health and wellbeing through activities and programmes based in local neighbourhoods. And on the other, we're an infrastructure organisation, so we support more than 400 voluntary and community groups a year to access the resources that they need to support local communities.
That's great, Louise. Thank you very much. Natalie.
Hello everybody, I'm Natalie Jode. I'm the Executive Director at a charity based in Norfolk called Creative Arts East. We exist to support rural communities across Norfolk, Suffolk and Cambridgeshire. We use the transformative power of the arts to improve those communities and the lives of the people that live in them.
Great, thanks Natalie. And finally, Colin.
Hello, I'm Colin Howey. I work for a local charity called MensCraft, which the overall aim of MensCraft broadly, by the way it's not the men's shed, is to nurture and empower gentler men, gentler with themselves and gentler with others. I think I'm here today partly because of my lived experience of growing up in sort of working class background with complex trauma. I experienced PTSD, and I've had to find another way of living in order to still be here.
That's great. Thanks very much, Colin. I've just realised you've all got your photos behind you and you're completely messed up. I do apologise for that. So it's interesting hearing that and hearing the different perspectives that each of the panel can bring to this. I want to start perhaps with Colin. Marmot talked about inequalities, he talked about how they affected individuals within society. And I'd be interested in your experience as what Caitlin described as experts by experience, from your background, your experience, and how the years of austerity and the pandemic have affected you.
Well, I think first of all, to take that back, because I'm going to tell you a little bit about my childhood. I think I grew up in a context of some intergenerational abuse, hand-me-down abuse. And I think that partly came as a context of poverty. My great-grandmother, who was too mean to die, she lived well into her 90s, she was one of 17 children who survived into adulthood. And she brutalised my granddad, he brutalised my mum, and under circumstances of great pressure, I lost my dad when I was 8 years old, had a second dad who died when I was 11. I thought I'd killed him because he died after a play fight with me. And I had a third dad by the time I was 14, and I was homeless by my later teens. And I think sometimes you have to look at that legacy. But I have to say I've got two wonderful daughters who are loved. And one of the things I'm very proud of is it stopped here. So I believe in that thing about be the change you want to see. The other thing I would say as well is that when I was growing up in the 70s, that's a long time ago now, but there was massive inflation and we were on widow's pensions, and there was a real squeeze disproportionately on us and my peers in terms of our kind of income and stuff, and that was obviously really, really difficult. But the other thing was overcrowding. I never had my own bedroom. I often shared a bedroom with two other brothers, and when that trauma and stuff closed in on us, suddenly space became a massive issue, and that was a hugely unhealthy context, and I think it was part of the context by which I got booted out. I would also say, working for MensCraft, that I'll be honest, my reaction to some of this stuff and confusion, I climbed into an identity that was available to me. I believe that patriarchy is bad for everyone's health. And I certainly inhabited a toxic male identity. I became uber violent. I was from a boxing family anyway. But as well as hiding behind my fists, I became a very sophisticated beater up of myself. And I found that that identity really didn't fit. And I think that that is part of the kind of the whole picture for me. And I believe passionately in positive masculinity. But we don't have time to go into what that is here. In terms of the legacy for me and my life course, bad teeth from homelessness, asthma from poor housing conditions, an eating disorder because I'm like a rescue dog having been hungry on the streets. I've had episodic mental ill health, but there is a lot, and by the way, peers, huge amounts of suicide, guys I know have been murdered, etc., who I grew up with, and so I've kind of seen that play out. But it's not just a story of hopelessness. I mean, that is a big theme here. I'm a self-made optimist, and it's about solutions. And I think in the work that we're doing in MensCraft, it is about creating hope, connection, friendship, and a sense of belonging. That is really, really important.
Thank you, Colin. That's great. And some really interesting ideas arising from that sense of identity, solutions, hope, and connection. Natalie, I want to turn to you in terms of some of those things, the identity, the sense of place and connection, which obviously arts organisations certainly help to engender. I'd be interested to hear of your experience with an arts organisation within the time of austerity, and how the challenges of that, how you were able to overcome the challenges of that potentially within that time.
Golly, well, we're still wrestling with it, frankly. Absolutely, I think like the health and social care sector, the cultural sector went into pandemic almost broken, and it's come out of it having not fared very well at all. But in arts and cultural sector is inherently creative, inherently collaborative. We think outside of the box. Outside of the pillbox, actually, in this setting. And, I think that very often people don't realise that the arts and culture provide, a fabric, an essential thread in the warp and weft of society. I think very often we're a nice to have, whereas actually, I think as we've seen from Professor Marmot's report, you have to invest to accumulate. You have to invest in early intervention in order to not fear and be subject to the incredible difficulties that come along from when you get to acute firefight, which is where we are as a society now. And I think very often the arts and cultural sector are undervalued in their contribution to the health and well-being of our country. I think that if you find somebody in an A&E line, I've said it to you before, if you find somebody in an A&E line, then they're probably you're too late. And you usually find them in early intervention, in the theatre, in the cinema, at the music gig, on the football pitch. That's where you begin your intervention. It's stealth prevention. It's about investing in the warp and weft of society, which is physical and creative health. And ensuring that you are, resourcing that early intervention. And we've proven that as a cultural sector. Pre-pandemic, there have been decades of evidence of the powerful medicinal impact of arts and creativity. At Creative Arts East, we run a program, or did run a program. It's transforming at the moment as a result of lack of funding. But for the last 10 years, we've run a program called Our Day Out, and it engages older people living with dementia or caring for somebody living with a dementia, or indeed a degenerative disease that makes them feel lonely and isolated in their community. We invite them to creative workshops every fortnight or every month. And in the pandemic, we provided them with postal participation packs when they couldn't get to sessions because that was restricted. And we've evidenced statistically significant increase in their well-being as a result. And that's by working with Dr. Hannah Zelig and Professor Kamick at Canterbury Christ Church University. And that is powerful. That statistically significant increase in well-being is as good as a pill in terms of, it's as good as an antidepressant in terms of the impact for those people. But very often the arts and cultural sector are left, we have to find our own funding. We have to resource that through project applications, where those project applications are time limited, sort of person or impact specific, and they fall off a cliff in the end, and then we have to go again. And what our funders like is shiny new projects, and that's what the health and social care isn't. It isn't a shiny new project. It is an essential contribution to our sort of survival, and the arts and cultural sector have a role to play, but we can't play it solo. And so I think what Professor Marmot is talking about ultimately is collaboration. And in that Coventry example, I couldn't see any non-health and social care partners around that table. I could see all of the usual players, but where was the arts and culture? Where was the sports and sort of physical activity? They weren't there. And I think that's where we need to begin now. We need to start afresh.
Thanks very much, Natalie. Really interesting in terms of that Coventry example, and I wonder if that was representative or comprehensive in terms of who was involved, because it does seem short-sighted if there aren't the arts and sports involved in that. I love your description of stealth prevention. I think that's a really important thing to be aware of, and as you described, the essential thread in the warp and weft of the arts in that, as good as a pill.
Proven.
I'll come back to you and Colin perhaps at the end to talk about how you're both engaging with academic research and understanding the effects perhaps of what you're doing. It sounds very interesting. But Louise, can I come on to you? Natalie and Colin just both touched on the role of volunteering in addressing health inequalities and the importance of volunteering in it. Marmot touched on it with Coventry, but only it felt in passing, and it feels like he was perhaps he just didn't have time to talk about it. But I'd be interested in your thoughts coming from Community 360 on the role, the value of volunteering to address these health inequalities.
I think there are two dimensions to volunteering, and thinking back to Marmot's point about kind of taking responsibility ourselves for our health and well-being. If I'm thinking about the opportunities that volunteering brings within our communities and the scale of volunteering, we know through the pandemic there was a particular light that was shone upon volunteering. That doesn't mean that wasn't there before. Very similarly to panellists, volunteers have been driving forward community-based activity for decades. Yeah. They do so in a very broad way, and they do that both as a benefit to themselves. Volunteers, we know, gain immensely from their experiences, be that something practical and looking forward to employability and to skills development, but more generally the social aspects and social connectivity that comes with volunteering. Yeah. But also then how communities benefit from that. Very often the examples I'm thinking of through the pandemic are of volunteers and voluntary organisations stepping into spaces when perhaps frontline services were having to move online, move remotely, where they were remaining face-to-face and forward-facing. I'm thinking of charity managers who spent 3 nights sleeping within their organisation to support individuals prior to testing coming in that they suspected may have COVID. I'm thinking of refugee community groups who are supporting people within the communities because they need to retain face-to-face contact. I'm thinking of arts organisations within Colchester. First Sight, our art gallery, opened up as the food distribution warehouse for our local communities. They opened up that space, and it was about recognising the assets that we have, whether that be volunteers and the time, the skills, the expertise that they bring are so diverse, but also the connections, the relationships. And for me, a lot of what volunteering can demonstrate is the power of relationship building versus service development and delivery. If we're supporting one another through positive relationships, they don't all need to be funded relationships. It's great in circumstances where that's required, but it's about strengthening relationships and building within our communities, and that can come through volunteering in an incredibly positive way.
Thank you. I love that idea of the power of relationships, which is very much what we're talking about today. You also talked about volunteering, stepping into the spaces where the service providers and others weren't able perhaps to act during the pandemic, which brings me very nicely onto Stuart and local authorities and perhaps what they were able to do during the pandemic, or the restrictions they had in the pandemic. I'd be interested to get your thoughts on both the pandemic but also in the times of austerity, where you've been having to tread a very careful line in terms of what you can provide with less money. Can you give me some examples of how you have been able to continue providing services and so forth to the community?
Yes, thank you. So I could talk about public health for hours, but I won't. Hopefully some of you understand and know about public health. Coincidentally, public health moved from the NHS into local authorities in 2013, during the time frame we're talking about in terms of austerity. And what has been a bit of a challenge was moving public health from an organisation which is non-political into one which is political. So the interface between public health and politics is always there. It happens locally and obviously nationally. So the policies that Michael Marmot talked about have had a direct impact on health. Equally, local policies that councils have a direct impact on health, because councils have always been interested in people's health and well-being since they started 150 years ago, when we had back-to-back housing and outbreaks of cholera. It's the same challenges and issues. There will always be new challenges and issues too, and not many people foresaw the pandemic. Well, some people did, but we weren't. Well, the COVID inquiry is going on at the moment, so we don't know how prepared we really were. But as you say, in COVID, that really did present a whole range of challenges. And as Michael Marmot said also, that the existing inequalities were really exposed and exacerbated. And the inequalities we see in health and health outcomes are persistent. So COVID was an infectious disease, and there will inevitably be more infectious diseases and possibly pandemics that develop. But the non-infectious diseases, heart disease, cancers, diabetes, are huge challenges to society. The rates of childhood obesity, for example, which lead to higher risks in all of those areas. If we approach those issues the way we approached the acute issue of COVID, we arguably would make a huge impact on the prevalence of those conditions, but also the impact at a personal level and on a societal level, and activity within hospitals, for example. And going back to the focus of today, public health, as I say, I could talk for hours, but if we go back to the definition of public health, which is something I often use, it talks about improving life, prolonging life, addressing health inequalities. But importantly, the phrase tagged on at the end is through the organised efforts of society. Now, this points to the fact that a public health expert or professional working in a small team in a local authority can't change population-level health outcomes alone. It's only through the work of others. And what the public health profession does do, and has to do well, is use the current configuration of the infrastructure, because as we know, that keeps changing. In 2013, we had health and wellbeing boards set up. We now have integrated care systems, integrated care partnerships. Hopefully you've all come across these terms and understand. But the relationship between the big players in terms of commissioning, the NHS and local authorities, the aim overall is to bring that closer together. But commissioning services alone, whether it's a service for whatever service it may be, won't achieve that population level health outcome alone. It's through the organised efforts of society, and that includes businesses, the arts, volunteers, a whole range of partners across society. And I think that's one role that public health has, sitting in the county council, bearing in mind Norfolk is a two-tier system, so we have to work with our district councils, and we have health and wellbeing partnerships at each place to really galvanise and support local action based on local need and also based on evidence of what we know works. So there's various roles that public health have within this, and the county council is really keen to support this degree of cooperation, collaboration and co-production. And this is something that the county council is, as I say, really pushing forward with. And I also use a quote from a previous incarnation of the public health system, Public Health England. Anyone who remembers that, disappeared a couple of years ago now, replaced by OHID NUXA. Plenty of acronyms out there. But the chief executive of Public Health England used to talk about what influences our health as boiling down to three things: jobs, homes and families. Now, jobs you can read across as meaning having a purpose in life. It doesn't have to be a paid employment. Hopefully it's good paid employment, but it can be volunteering, it can be working in the local community, whatever. Having a purpose to life. Homes, obviously the physical condition of the home in which we live, but also the environment, the built environment we live in, access to green space and all the rest of it. and families. And again, the family, as we've heard about, lived experience can be hugely varied, and the social networks we grow up in and the opportunities and aspirations we have all stem from those three things, I think. And what we can do collaboratively through whatever infrastructure and organisation or recent reconfiguration that may happen now or in the future is the challenge we all have. So that's what I see as the public health role in that.
Thanks very much, Stuart. It is going to be the theme of the day, the cooperation, collaboration and co-production. On that point, also on the fact, the first point you made about public health and politics, you can't extricate those two, there's a mutual relationship there. And Kevin, I know that a lot of your work is around informing policy and engaging with policy makers. Could you say a bit about your work in terms of that? How does that happen? How is that possible? Is it possible? Can you say?
Well, it's changed. So yeah, in the past I was involved a lot, especially with the health and safety executive, around, and this is from the kind of research background in occupational health and safety, especially around looking at how work and employment conditions influence mental health and other outcomes. Incidentally, Michael Marmot got famous in the 1980s for studies of civil servants' working conditions and how that contributed to heart attacks. So, and that kind of fed into a lot of the frameworks the Health and Safety Executive developed, and we've been involved in work with Department of Work and Pensions as well. I think on the policy angle, there's a couple of quite profound difficulties at working at very, very high levels. First, I'll take occupational health as an example. Return to work. So if you're off work with a mental health condition or a musculoskeletal condition, that's Department of Work and Pensions. Preventing those things in the first place, that's the Health and Safety Executive, which is actually a department within the Department of Work and Pensions, but sits separately. And in between that, Department of Health and Social Care, so that's making people get better. So you've got three departments there, each with different policy objectives as well, and with the Health and Safety Executive, a very, very constraining legal framework that they have to work in as well. So you've got that kind of at a policy level. Also at a policy level, and you can see it in the Marmot principles actually, you either have to have policies that are so detailed that cover all eventualities that they're effectively not usable because you haven't got the resource to actually figure out what the frameworks are saying. So if any of you have got insomnia, read the nice guidelines on occupational health, especially around mental health. I understand them because I'm a specialist, but they are quite dull. They run to about 90 pages or something like that, so no small employer is going to read that. And you see it in the Marmot principles, the principles are at such high level that it's difficult to know what they actually mean. So, who's going to disagree with strong communities, but what does that mean in practice? So at the other end of the scale, and I think this is where involvement with the voluntary sector, with business groups, with districts and county councils is really important for universities. You can actually figure out what action means in reality for specific localities or for specific groups. And I think so you need that complete spectrum. Working in the policy sphere is great, it's really interesting, but all you're doing is shaping the space. You're actually doing things practically, then you do need to engage as a research institution very much through things like the Citizens Academy and the other things that we're doing on our current project, which is going out and finding out what people are doing, finding out what their priorities are, finding out what things look like in practice within those general principles. So in my own sort of area of employment, pay is pretty easy to understand. Job security is pretty easy to understand. When we start talking about conditions at a very, very high level, we talk about things like the amount of control you have over your work, the amount of skill use you have. That's fine. Those are universals. What it actually means on the ground for, say, an 18-year-old doing a summer job is very different from what the head of a medical school might experience, but the principles are the same, so you have to understand at a very, very detailed level in order to make that kind of practical action, which I think is why the kind of very localised or regionalised collaborations are really important, not just for improving communities, improving health outcomes, but it also feeds back into the research in a big way and enhances our understanding of what is possible. I think the other thing, just to kind of end on this point as well, if you're involved in the policy sphere, you might develop a framework or something like that, or contribute to a framework, or say you've influenced a policy or something. No, that's it. That's you go. The website's there. I think if you're doing work with local communities well, you don't as a university, or shouldn't as a university, do this kind of fix and leave mentality, where you go and you do something and then you just disappear. I think it is about continual engagement with the groups that you're engaged in, and ensuring that things build and maintain a momentum. Otherwise, you don't see whether things fizzle out or not, because you're not there.
Thanks, Kevin. That's an important point, the avoiding the fix and leave mentality. And you talked about shaping the space, which is all very well, but the need to get out there, to talk to people, to find out what's happening on the ground. So just to finish this, Colin, I want to come back to you on this in terms of how academics and researchers have been getting out there and finding what's happening and talking to experts by experience. Can you say a bit about how that's worked for you, how that came about in engaging with, I assume it was colleagues at UEA that you were working with?
Well, I first got engaged with the UEA through the Civic University initiative and the consultations around that. And it is about networks, it's about relationships, and we've had visits from the Citizens Academy to our pit stop social, for instance, and we've also had them in other pit stops across the county. So that's been really good. We've also commissioned recently some research, or in the process of this, from the NSFT around, we know that there is a positive meaning and advantage and outcomes from having some male-only spaces. That's part of what we do in MensCraft, but we don't have the evidence base to actually show that. So we're working together to try and build that evidence base. But the thing about our cohort of members is 80% of them, in Norwich at least, 80% of them are from circumstances of poverty. They have all these issues, and there is a whole body, literally bodies of people who I think places like the UEA and other agencies should be involved with, and we have the people. And the other thing is, somebody said about the empowerment of being involved in research and being heard and being valued, and I think that's a really important thing that I'm certainly stressing to try and get our members engaging and going on that journey. And not just to say another thing, I'm really interested in lifestyle medicine and the power of that, and I really would like to see our part of what we do. For instance, on our pit stop social, when I started, it was cakes and biscuits. We now have Medjool dates. They don't lower your glycemic index. We pop some walnuts in, so they're a cert food. So, it's thinking around that and then starting getting going. And we've got a new initiative, because when I did an audit on what we're doing, we weren't cooking. And so we're going to have pies for guys. And so basically that's going to be an opportunity for us to get really active about that kind of education and that involvement as well. So, yeah, there we are.
Brilliant. I'm conscious of time because we've only got 15 minutes for a comfort break and a shot of coffee until the next session. So I want to give you as much time on that. I've been writing reams of notes, as you've seen, so it feels like it's just the beginning of the conversation. But can you join with me in thanking our panel, Kevin, Stuart, Louise, Natalie and Colin.
Thank you. Thank you.